Strange, but fasting is more than just a way to lose weight. In fact, it can help change the way your body processes blood sugar and reverse type 2 diabetes. Want to know more? Type 2 diabetes is not an unchangeable condition, and one natural method is gaining more and more attention: fasting. In this video, I share how fasting can help you control your blood sugar and even reverse type 2 diabetes. Watch until the end as I walk you through safe and effective fasting methods, along with essential tips to get started today. Fasting and its surprising benefits for type 2 diabetes. Fasting is not a new concept. In fact, it has been around for thousands of years, known as a method to improve health and prolong life. However, it is only in recent years that scientists have begun to explore more deeply the mechanisms of fasting, especially its effects on type 2 diabetes. And the research results are truly impressive. One of the outstanding benefits of fasting for type 2 diabetes is its ability to help the body eliminate excess glucose in the blood. When you fast, the body switches from using glucose, blood sugar, to using excess fat as its main source of energy. This process is called ketosis, where the body begins to burn excess fat instead of relying on glucose from food. This not only helps reduce blood sugar levels but also supports weight loss, an important factor in improving diabetes. In addition, fasting also helps the body restore and improve the function of beta cells in the pancreas, where insulin is produced. When you give your body time to rest from continuous food consumption, these cells can work more effectively, reducing insulin resistance, one of the main causes of type 2 diabetes. With such obvious benefits, fasting not only helps improve blood sugar levels but also reduces dependence on medication, helping people with type 2 diabetes to better control their condition. However, to perform this method safely, you need to consult your doctor and make sure the method is suitable for your health condition. Simulated fasting, a modern fasting method that helps reverse type 2 diabetes. Simulated fasting is emerging as an effective and modern fasting method that helps improve the condition of type 2 diabetes without having to fast completely. What's special about this method is that instead of giving up food completely, you only need to eat a very low-calorie diet for 5 days a month. The meals in this regimen will be designed to mainly include low calories, low sugar, low protein but rich in healthy fats and complex carbohydrates. The main goal of this diet is to reduce insulin levels in the body and improve metabolic function without having to fast the entire day. A prominent study in 2024 showed that people who followed a simulated fasting diet not only reduced their diabetes medication but also had significant improvements in blood sugar levels and weight loss. Participants in the study reduced their medication by an average of 40%, and in some cases were even able to stop taking their medication altogether. They also lost an average of 3.6 kilograms, 7.8 pounds, of body weight and 2.2% of body fat, impressive results that demonstrate the effectiveness of this method in managing type 2 diabetes. The great thing about fasting is that not only does it reduce medication and improve blood sugar levels, but it also helps the body improve metabolism and cell function, especially for people with type 2 diabetes. However, as with any treatment, you should consult your doctor before starting, to ensure that it is suitable and safe for your health condition. 5:2 Fasting, another strategy to control diabetes. In addition to simulated fasting, another fasting strategy that many people are using to control diabetes is the 5:2 diet. This method is quite simple and easy to follow. For 5 days of the week, you eat normally, and for the remaining 2 days, you will fast or consume only about 500 to 600 calories per day. Although there are only 2 fasting days, research has shown that this method has a strong effect in reducing blood sugar and supporting weight loss. A recent study compared the 5:2 diet with the use of metformin, a common drug in the treatment of diabetes. The results were surprising when they showed that the 5:2 diet not only reduced blood sugar but also improved A1C index, average blood sugar index over 3 months, much more effectively than taking medication. In particular, the group of people who followed the 5:2 diet had an A1C level of less than 6.5%, which shows the ability to significantly reverse diabetes even without using medication. With the 5:2 diet, you will not feel deprived of food throughout the week. Just persevere and follow it correctly, you will see a significant improvement in blood sugar levels, while also helping you lose weight, improve your overall health and reduce the risks associated with diabetes. Although it is only 2 days of fasting, the results this method brings can be surprising and truly life-changing. Results from clinical studies. Recent clinical studies have shown remarkable results on the effects of fasting in the treatment of type 2 diabetes. One of the most prominent studies was the INTERFAST-2 study, where type 2 diabetics fasted for 18 hours, 3 days a week. The results were impressive. The fasting group had a significant reduction in A1C levels, and they also lost a significant amount of weight and their diabetes medication. This suggests that fasting not only helps control blood sugar, but also aids in weight loss and reduces dependence on medication. Another study from 2023 used a 5-day fasting regimen every month with an 840-calorie diet, alternating with a normal diet for the remaining 10 days. The results showed that 44% of patients in the fasting group achieved drug-free status, while none of the control group achieved this result. These numbers are strong evidence for the potential of fasting as a natural and effective diabetes treatment, helping to reduce drug dependence and improve overall health. With these clinical results, fasting is emerging as a promising treatment for type 2 diabetes management, providing outstanding benefits not only in blood sugar control but also in helping patients lose weight and maintain long-term health. Is fasting right for you? Fasting can not only help you lose weight, but it can also have long-term benefits in controlling and even reversing type 2 diabetes. With a variety of fasting strategies, including simulated fasting and the 5:2 diet, you can choose the method that best suits your lifestyle, habits, and ability to adhere to it. Fasting can be more than just a weight loss tool, it can also be a powerful way to improve your health. If you have type 2 diabetes or are at high risk for the disease, fasting can be an effective treatment strategy. However, before starting any new diet or treatment, be sure to consult your doctor to ensure that it is safe and appropriate for your health condition. Everyone has a different body in response to fasting, so choosing the right method, with medical supervision, will help you achieve the best results without risk. Remember that the journey to better health is an ongoing process, and patience, combined with sensible strategies, will bring you closer to your health goals. Fasting can be an effective way to reverse type 2 diabetes, but it is important to do it wisely and with the guidance of your doctor. Fasting properly can not only help lower blood sugar levels but also improve overall health. Remember, every body is different, and consistency, combined with a healthy diet and regular exercise, will yield the best results. Don't forget to follow and consult more information to ensure you stay on track in your health journey.